understand anatomic landmarks when we're talking about the gingival tissue of the oral cavity, because as we talk about gingivitis and periodontal disease, those diseases are going to affect the gingival tissue and all the gingival landmarks. So when we're talking about the gingival tissue, the gingival margin, that's the part of the gum tissue that you see that's the very edge of the gum tissue. That gingival margin should be 1 to 2 millimeters coronal to the level of alveolar bone around the tooth itself. There's a mucogingival line that looks like an indentation, essentially, in the gum tissue above the tooth, and it's called the mucogingival line. And you'll see that in the maxilla, which is the upper jaw, and you'll see that in the mandible, which is the lower jaw. The mucogingival line is going to separate the attached gingival tissue, which is coronal to the mucogingival line, from the alveolar mucosal tissue, which is apical to the mucogingival line. The gingival sulcus is the space between the marginal gingival tissue and the tooth itself. Normal sulcus depth in a dog should be about 3 millimeters. That varies, obviously, dog to dog. Gingival sulcus depth of 3 millimeters in an incisor of a Great Dane is clinically not significant, but a gingival sulcus depth of 3 millimeters in the incisor of a Chihuahua is going to be clinically significant and indicative of periodontal disease. Gingival sulcus depth in a cat should be less than 1 millimeter. So those are important things to recognize so that when we're probing and charting around each tooth, we recognize when periodontal disease occurs.